Welcome back to CBS Eye on Health. With us now is Dr. Anil Singh, AHN pulmonologist and the Executive Medical Director of Clinical Solutions Design and Implementation for Highmark Health. Dr. Singh is also Lori's lung specialist here in Pittsburgh. So, Dr. Singh, let's begin with this big question. Why Johns Hopkins?
The reason why we chose Johns Hopkins to partner with was their overall clinical outcomes, their quality on the patients that they have actually transplanted. They have been just outstanding. The time to the transplant is shorter than most areas of the country. And really their clinical team has worked so well with us at AHN that we really created a model that to our knowledge is exemplary from across the nation.
So, why is this partnership with Johns Hopkins so important for patients in the Pittsburgh area?
Well, because the basic premise is that the patients from Western Pennsylvania can get the highest level and highest quality of care for lung transplant that we just don't offer at AHN. And as a result of that collaboration that we've done, patients really are managed under the care of an AHN physician. All of their lab testing and radiographical testing are actually done within the walls of our own area. And it's really only at the time that the patient is selected for transplant that they actually have to travel to Johns Hopkins. Once the patient then gets transplanted, they come back under the care of myself and other AHN physicians. And really the move back and forth from Pittsburgh to Baltimore is completely limited. So that was one of the reasons why we selected to choose Johns Hopkins as a partner.
I see that makes absolute sense. So, as it relates to how the AHN team works with patients, for instance, like Lori, to become eligible lung transplant candidates, what's that process?
Yeah, because ever since we stood up this partnership, one of my jobs at AHN within my practice is to evaluate any patient that might be interested in having a lung transplant. Because we've worked together with the Hopkins team, we've aligned on the test that would be required to be done for patients to be eligible for transplant. We do all of that testing up front here in Western Pennsylvania at Allegheny Health Network. And once all that testing is done, myself and the transplant team at Johns Hopkins actually have a collaborative conversation where we review those patients. And then once we've kind of aligned on those patients, we determine which ones are selected to come up to Baltimore for being evaluated as a final kind of say as to whether or not they will get transplanted or not.
So I understand that in Lori's case, at first she wasn't really an ideal candidate for this. So what was it that she needed to do in order for her to be placed on the list?
Yeah, I don't know that she wasn't an ideal candidate. I think what actually happened is she was probably felt to be too early for transplant. And the best way I can describe it is that there's a sweet spot for transplant. Some people have to be not terribly too sick, but then also they can't be too well either. There's just this very fine line where a patient would actually fall into the window of transplantation. And when I first met Lori, she was a little bit early. And she needed to do some things to get her prepared for being evaluated for transplant. And some of those things included pulmonary rehab, making sure we kept her out of the hospital as much as possible, and really trying to manage her disease and optimizing as much as we could her health status to the best of our ability. At the point when we sent her down to Hopkins, it was the point where we kind of said, okay, she's close. She's still a little bit early, but at least we can get her into the process, get all of her testing done, because we knew that eventually her trajectory was going to decline. And that's based on the history of the disease and based on her history itself clinically. So because we actually did all of the upfront work, again, in close collaboration with AHN and Hopkins, we were actually able to have everything completed. And so by the time that she was listed, everything was done. And then really it was just a matter of time before an organ became available. And that was one of the again, beneficial things of having this partnership with Johns Hopkins was their time on the waiting list was reduced more so than many other places. And as a result, she was able to get her organ very quickly compared to many other institutions.
Yeah, and that brings me to this next question. Obviously, there is some work involved and a progress that anyone would have to undergo. But generally, how long can it take before someone actually has the transplant surgery?
Yeah, it depends on the stage of the patient, on the course of their disease, and the time that they come for evaluation. In the best way I can explain it is that some patients will see me. At that point, I'll make a determination as to whether or not they're eligible for transplantation. If there are things that are not quite done yet that need to be done, we'll actually put them through the process of completing those testing and those maneuvers, if you will, to make them ideal candidates for transplant. And so that time period may be extended. So in Lori's case, it took upwards of a year. In another case, some patients are coming a little bit later in that spectrum of disease where they're a little bit more sick. And we kind of almost push them through a little bit faster to make sure that they complete all of the testing done. And then they may get listed a little bit sooner. So it really depends on the illness of the patient. It depends on the disease state that they're in and the spectrum of where they fall on that line.
Has COVID had an impact on the program?
It has, and in some ways, the in-person visits have obviously declined across all of care. So we've been doing a lot more things virtually and video visits per se. And so I would say that's been the impact. I think Lori has appreciated that because she's not had to travel down to Pittsburgh to see me as much, and we've been doing things over video. The first few weeks that she came back, I did see her in person. But you know, it has had an impact. But on some level, I think we've been able to evolve the care of these patients and learn to manage them differently than what we had in the past.
Yeah, and certainly with Lori, obviously you've had the opportunity to work with her. And so she, of course, is the first AHN patient to be listed for lung transplant through the program. What was it like for you working with her and having her on the list?
Yeah, I think you know, it was definitely a work in progress. You know, we wanted to help her as much as we could. I think, again, the relationship building that occurred between the clinicians at AHN and at Hopkins were really the key to her success. You know, most programs, if I were to refer a patient to, the communication to the physician begins to lapse because it's being taken over by the transplant team, which is appropriate. In this case, because we have that relationship, I'm directly involved into the care of the patient. I'm part of the meetings. We discuss her care. We discuss things that can happen. And so I was made aware that she was an appropriate candidate for transplant, that she would be listed. I was made aware when the organs were available. Once she actually did get the transplant, I was present via a video visit in the ICU while she got extubated. So they really did, you know, again, it's part of this partnership that formed that created this just unique way of collaborating the clinicians caring for the patient locally with the Transplant Institute. And I think that's been phenomenal. I was able to connect with her family members as well, with the Johns Hopkins clinical team. And we really kind of co-managed this patient all the way through.
You know, one of the things that Lori mentioned was that Johns Hopkins had multiple sets of lungs for her, one that, of course, ended up being a good match. Can you explain why this is so unique and important for patients?
It's important to make sure that we find a set of any organ per se that will not reject in the person's body. And so some things that may be thought of as an example, when the clinical team goes out to evaluate the donor's lungs, they have to make sure that the lungs are as pristine as possible. And so sometimes it may be a match, but there might be something wrong with the lungs. And the clinical team at that point in time will say, well, this is not an appropriate set of lungs for this particular patient. And therefore they will say, we don't want to put this in you at this point in time. And then that's what happened with Lori. And it wasn't until that they got another set of lungs and they said, hey, there's not much wrong with this one. We think that this is an appropriate set that will fit Lori. That's the one they picked. So it's not just because a set of lungs are available that means it will fit with every patient. You have to, it's not until you actually get in there and are able to actually look at it or take a biopsy of it and make sure that there's nothing wrong with it, that you can actually begin to tell that difference. And sometimes we don't know that grossly when you're just looking at it.
Yeah, that certainly makes sense. So now that she's had her transplant, what does her recovery look like?
Fantastic. I mean, I think one of the greatest things for me as her clinician and her physician was to see her off oxygen. The fact that she came to see me, she was not carrying around an oxygen tank. I think that we take for granted sometimes about how life changing that is for a patient who's been tethered to an oxygen tank for a long period of time because of their life. For her to be able to walk into my office with no help, with no oxygen tank, with no oxygen around her, I think that was one of the most important things that I could have, seen right off the bat, that was a difference. She has been an extraordinary patient. I'm so glad she was our first one. She is as compliant as they come. She does everything that we ask. She does it to the best of her ability. She has amazing social support from her husband and her family around her. And so because she is such an amazingly compliant and really wanting to do so well for herself, I believe that her outlook is just outstanding.
Oh, that is so wonderful. And can you share with us a little bit more about her long-term care?
Yeah, her long-term care, again, very similar to how we did the pre-transplant. Her long-term care will be co-managed by myself and the folks at Hopkins. So we almost take turns in seeing her. I might see her every other week, and then the Hopkins team will see her the in between weeks. And we collaborate in between to talk about her care, about things that we can do, adjustments in her immunosuppression medicine, talking to her about her social status and her mental status, and to make sure that she's still doing okay. All of those things are actually, even more so important than the upfront part. It's the post-transplant care that really matters the most.
Definitely. Well, thank you so much for being with us today, Dr. Singh. We certainly appreciate getting your perspective. And we'll be back with more. After the break, we're going to hear Lori's perspective on her recovery. Stay with us.